As President Cyril Ramaphosa prepares to address the nation tonight at 8 p.m. on possible stricter restrictions, the question is it too late? Some sectors have criticized government's non-responsiveness as the third wave of battered Gauteng province in recent days. The province is reporting a strained healthcare facilities as experts confirm that the Delta variant, which caused havoc in India, is behind South Africa's third wave. Dr. Aslam Dasu, co-convener of Progressive Health Forum, joins me now for a discussion on this. Great to speak to you. We have a situation on our hands, and I've listened to you in the last few days, been very, very critical. And it appears that the ball has been dropped. Where was it dropped?
Good morning, Hugo, and thank you for inviting me. Look, it's deeply disappointing that we find ourselves in the situation we do. I am looking forward to what the President will say this evening, because some decisive interventions need to be made if we are to get through this horrendous third wave. And of course, our situation has a historical line to it. It has been a series of events and decisions that have been made that have brought us to this point, not least around vaccination or getting the health system ready. So we are greatly alarmed at what is unfolding right now. And therefore, whatever the President says today has got to be a plan that manages the situation that we find ourselves in right now, gets us through this wave and into a phase where we can consolidate whatever resources we have to meet the future expected waves of this pandemic.
Dr. Dasu, let's look at government's interventions, or certainly their reactions. I think almost 3 weeks ago we went to a moderated level 3, right, which saw the curfew come down an hour or two, no alcohol sales after Thursday, for instance. Was that an opportunity for government to put in stern restrictions and not allow for things to reach the alarming levels that they've reached now?
Of course. And I think it's also a fact that there's not much room to move in terms of restrictions, barring some decisive interventions one can make right now, and I'll come to those. But because the government is unable to move on the big stuff around the economy and so on, there's just no fiscal space to do that, it finds itself a little hamstrung. The more important activity it should have engaged in was to prepare the health system. Right now, Gauteng is scrambling to do stuff that they should have done months ago. Put in contract staff, open up beds, ensure that the facilities are able to manage this huge influx of very sick people and treat them. They've done none of that. And to do this in the midst of the crisis, as they're trying to do now, is going to be a series of hit and misses. And you know that in the health situation, you take one wrong step and you're down a dark path. And unfortunately, we have been placed in this situation. The Ministerial Advisory Committee, we know, has advised on measures to be taken that have not been adhered to or considered by the government. And therein lies, I think, a major problem. Because the Ministerial Advisory Committee...
What are some of these measures? Let's take a look at that.
Sure. So I think immediately what we have to do is to limit all gatherings, certainly those over 20 people. So all non-essential gatherings should be completely prohibited. All religious gatherings, all social gatherings, parties, music events, sport events, that sort of thing must be stopped immediately, at least for the next few weeks. I think the commercial sectors that where people congregate should be similarly curbed. I think it's going to hurt if we close restaurants and pubs and taverns, because livelihoods will be lost and jobs will be lost, but lives will be lost if we don't do that. And the government should subsidize those industries better than they're doing with this 200 billion rand loan guarantee scheme they've got to keep businesses afloat, so that after this they can resume activity and keep their staff employed. So these measures have been spoken about for months, but none of this has actually come to pass. The other measures that I think should be taken is around schools. We know we are coming up to the end of term. They should bring that forward so that schools close. It's not that schools themselves are sites of infection. It's the movement of people to and from schools that's a cause for concern. So I think we do need much tighter restrictions, and I expect that he will try and put some of those in tonight. That's the president. But mainly that horse has bolted. We are now facing the deluge, and we have to now strengthen our health system as a primary endeavor at this point.
Vaccination has always been high on the cards. We're not doing enough of that.
Of course not. We have one of the lowest rates of vaccination in the world, and correspondingly one of the highest death rates in the world from COVID. This is an unfortunate correlation, and it needn't have been so. Look, we know we started late, and it only started when there was an outcry about a lack of a vaccination strategy at the beginning of this year. In the 6 months that have followed, we have managed to vaccinate just over 2 million people, where countries, the bigger countries like China are vaccinating at over 20 million a day, the US at over 1 million a day, and so on. Our African peers are way ahead of us in terms of population vaccination. Of course, there is a shortage of supply of vaccines, we know, but our own actions have certainly not helped in bringing more vaccine in. Vaccination, even at scale, if we were able to do it from today, is not going to prevent this third wave from doing what it is doing. But it is imperative that we do vaccinate at scale, and that we do so in order to attenuate the impact of future waves. We are not going to get herd immunity with this generation of vaccines, but we will stop severe illness, hospitalization, and death. And, you know, the bottleneck created by the government being the only procurer of vaccine is a proximate cause of our lack of vaccination, of vaccine doses in this country. It would have been a different case if our government was so super efficient at procuring vaccine that we could leave it to them to do it. But they have demonstrated that this is not possible. And therefore we need to use the best officers of the sectors in our country that have the wherewithal to acquire vaccine globally, bring it in, register it, put it into the national pool. We should open that up. There's a control freakery at the Department of Health that is really damaging the fight, and they need to let that go. In particular, the recommendations of the Ministerial Advisory Committee should be made public, and it should be transparent, and the politicians who then have to decide on those recommendations and who may not take them all up, and that is their right, must then demonstrate why they haven't done so. That builds confidence in society, especially in a low-trust society like ours. That Ministerial Advisory Committee currently in place is not serving us well. It is made up of insiders and outsiders, and there's political machinations going on. It should be an independent body, public body, that makes purely scientific recommendations around public health emergency like this.
For Dr. Dasu, I'd like to think that many of the people that are sitting on the Ministerial Advisory Committee are individuals that are professionals, individuals that are putting across the right action plan that government needs to carry out. But the issue is, will government implement? So it's not really about the right constitution as much as it is about the willpower to implement those recommendations, is it not?
Yes, but we can't rely on the fickle will of politicians to implement recommendations from an advisory committee that is without any authority on its own recommendations. So it is also a fact that we are managing this in a very secretive manner. There is a lot of unhappiness among the top scientists that sit on that committee, on that Ministerial Advisory Committee, that try their level best. And we have world-class science in this country that we're not using to its fullest extent. And what we see coming through is are decisions that seem to have extraneous features to what has been recommended by the Ministerial Advisory Committee. That is why we are calling for this Ministerial Advisory Committee to be reconstituted urgently as an independent structure, transparent, open to the public, all its advisories published, those that the government receive and want to modify, they must just explain why they do it so. That way, there's more, like I said, confidence in society about what the government does. Make no mistake, this government is not the only one in the world struggling with this. There have been many who've had even far worse performances than our government. But that is no excuse, given the attributes we have, given the resources we have. And I think this is about, you mentioned political will. Sure, there must be a political will to be open. There must be a political will to take the best advice and to act in the best interests of the country, not in the best interests of political ideologies. This virus is bigger than us. It's bigger than the politicians. It will punish us for our tardiness. It will punish us for our wastefulness and our inability to pay attention to what it can do. And unfortunately, we are demonstrating that in droves.
I'm fascinated that you talked about the punishment that will accrue to us based on tardiness or failure to pay attention. Now, the WHO has announced that the triple mutant, the Indian variant, which is the Delta variant, a few days ago, as a variant of a global concern. Now, what are we doing? Are we, as a government to South Africa, aware that this is where it's at? And if so, what moves have been made to counter it?
It's fortunate that we have the science here that can sequence viruses and their variants, as we did with the Beta variant that was first discovered in South Africa last year. And we have that capacity, and we have determined now, and the government has accepted that the Delta variant seems to be dominating and driving infection. The Delta variant is up to 60% more transmissible than the Beta variant. And it's not surprising that once it takes hold, it will spread like wildfire. And here's the thing, we're not sure yet if it leads to more severe disease. What we do know is that a number of the vaccines have shown differing efficacies against this particular variant, but they are all still effective against it. What this variant does is increase the load of active cases to such high numbers that while it doesn't change the proportion of those who will get severely ill, just the sheer weight of the numbers of those who do get severely ill overwhelms the health services. So that's the consequence of the Delta variant dominating now in the country. It is what it is. We are facing it. India has faced it. The UK is facing it. Several states in the United States facing it. And I think this is going to become the next phase in this pandemic, where we deal with Delta as best we can. Now, in our situation, given that we have such a low rate of vaccination, that means that we all have to protect ourselves now. And the only way to do that, and I must emphasize this, is to avoid being in contact with people, because that's what transmission means. It's very simple. It's common sense. Do everything you can to stay at home in your bubble. Leave your home only for essential reasons. Avoid all gatherings that you can. And if you cannot, make sure that there are less than 20 people there in well-ventilated spaces with all the NPIs in place. And of course, the measures that the government can put to reduce mobility within society as best it can now, it should do that. And I expect the president will do that tonight. But when we hear him, we will also have to factor in the very real situation we have, where there's not much room to do much more than we already have done. And the focus must shift now to the health services, which are buckling and are overwhelmed. There are no beds. People are being sent home to die. And we have to arrest this. We have resources. There are staff that can be immediately employed. There are beds that can be opened. But in the Gauteng Department of Health, which looks like it's in some kind of death spiral, it's not able to meet the moment. And this is really disappointing, especially since they have been warned in March already of this wave hitting us almost to the week. Nothing was done. Now, this is unfortunate. And, we'll have to account for this. But for now, we have to accept what we face. Don't fall ill. that's the most important message. Do all you can to avoid that, at least for the next few weeks, so that we can get through this with as little damage to society, to families, to communities as possible. The Delta variant is unrelenting, as the SARS-CoV-2 virus overall is. And it's an adversary that we have no protection against. We're not in a war with it. If you think you're in a war with this virus, then you've already lost the war. We are in a situation where we have to protect ourselves from a virus that's indifferent to us and that will do what it does, and that all behavior that allows it to do that must be curbed.
Finally, Dr. Dasu, I'm going to come back to the issue around schooling. You've suggested that schools should be closed, but there's growing concern around the closure of schools. In fact, many quarters have said that the time lost in schools being closed in the last 12 months has taken us back 5 years. So how do you marry the need to protect the lives of individuals, but also safeguard the gains that we've made socially?
Sure. Look, we may not have needed to do a lot of the things that we are now forced to do had we just made the correct decisions. But we are here now, and we must now look to how we best protect people. And I think that I completely agree. There should be no further threat to the academic year. Teachers are being vaccinated for good reason, so they can go to school and keep schools open and pupils in class and learning. There's absolutely no argument with that. I think in our situation right now, particularly in Gauteng and very soon in the Western Cape, there is a case to be made to bring the term to a close a little earlier, have the break, because that break will coincide with the peak. It's best to have the children at home when we're doing that, not having them to travel to school and travel back, and teaching staff doing the same, so that we reduce that mobility for this period. If we were to bring the holidays forward, you don't lose tuition time. And I think that is a very sensible approach. It in no way is an additional risk to the academic year. Of course, there will be logistical difficulties, but we've had a year and a half to work those through. The teacher unions are on the case, and I think we'll be very cooperative. And I think parents will have to make the means and the plans to keep their children at home, not gathering in other groups and spreading the virus even more. But the main benefit will be the reduced mobility that comes with open schools at this particular point. So I'm in complete agreement with everyone who says that we should avoid all further threat to the academic year through school closures. However, we face a very real situation right now of people getting very sick and many dying, and I think that should concentrate all our minds, and we should make decisions that give us the comfort that we are addressing the issue, including bringing the school term forward.
Dr. Dasu, it's been great. Absolutely appreciate your time this morning. Dr. Assom Dasu, co-convener of Progressive Health Forum. And summing it up for us, we are faced with a bleak situation, and he says, if you can, don't get